Have you noticed your dog doing that embarrassing little scoot across your brand new carpet? You know the one. Bottom planted on the floor, back legs dragging forward, scooting across the room, leaving a waxy, fishy-smelling streak behind them. Or maybe you have caught your dog obsessively licking or chewing under their tail late at night, and you cannot figure out why. Watching our best friends do something so uncomfortable and so awkward can be frustrating. But what if I told you that this nasty little ritual does not have to be your daily reality? What if I told you there are specific science-backed kitchen and lifestyle secrets you can start using today to help your dog's anal glands empty naturally on their own, often within just 1 to 2 weeks, and dramatically cut down the scooting? You do not have to live life scheduling monthly gland expressions at the vet. You have the power to actively change your dog's daily comfort and significantly clean up your floors. Hi everyone, I'm Dr. Logan Wells, your neighbourhood veterinarian. Today we are doing a complete masterclass on canine anal gland health. I'm going to teach you 3 highly effective, vet-approved home strategies you can start this week to help your dog's anal sacs empty naturally during normal bowel movements, reduce chronic inflammation inside the glands, and slash those embarrassing scooting sessions. In fact, if you follow these 3 steps consistently, most pet parents see a real, visible drop in scooting within 14 days. So grab a warm cup of coffee, call your dog over for a belly rub, and hit that subscribe button to join our family of educated pet parents. And let us dive into trick number 1, which starts with what you put in their food bowl tonight. Trick number 1. This is a kitchen cabinet nutritional strategy that takes about 10 seconds of prep per meal, and it is built around the actual biomechanics of how anal glands are supposed to empty. Let me explain the anatomy first. On either side of your dog's anus, at roughly the 4 and 8 o'clock positions, there are 2 small grape-sized sacs. Inside those sacs, the body produces a strong-smelling, oily fluid. In the wild, this fluid is your dog's signature, used to mark territory and identify themselves to other dogs. The healthy, natural way for these glands to empty is during a firm bowel movement. As a solid, well-formed stool passes out of the rectum, it physically presses against the 2 sacs like 2 little grapes being squeezed between your fingers. That pressure squirts the fluid out onto the stool, and the gland is naturally expressed. This is how Mother Nature designed the system. Here is the problem. When a dog's stool is consistently soft, mushy, or low in volume, there is simply not enough physical mass pressing against the sacs to squeeze them empty. The fluid just sits inside, thickens and builds up over days. That is when the scooting starts. Your dog is trying to use external pressure, scraping their bottom on your rug, to manually express what the stool failed to do. To fix this, we engineer the stool to do the squeezing for us, and the tool is fibre. The single most powerful vet-recommended fibre source for this job is plain, pure canned pumpkin. Not pumpkin pie filling, pure pumpkin. 1 ingredient. You can find it next to the canned pie fillings at any grocery store for about $2 a can. Here is how to deploy it. For a small dog under 20 pounds, stir 1 to 2 teaspoons of pure canned pumpkin into their regular food at each meal. For a medium dog between 20 and 50 pounds, use 1 to 2 tablespoons per meal. For a large dog over 50 pounds, you can go up to 3 to 4 tablespoons per meal. The pumpkin binds with water inside the intestines and forms a bulky, gel-like stool that is firm enough to physically compress the sacs but soft enough to pass comfortably. You are essentially manufacturing the perfect internal squeeze. Now please listen to this vital safety warning. 3 things you must memorize before you open that can. First, you must use only pure canned pumpkin. Pumpkin pie filling contains nutmeg, sugar, and in some brands, xylitol, which is highly toxic to dogs. Read the label. If the ingredient list says anything other than pumpkin, put it back. Second, you must ramp the pumpkin in slowly over 5 to 7 days. Adding a huge fibre load overnight will cause severe gas, bloating, and discomfort. Start with 1/4 of your target dose and work up gradually. Third, canned pumpkin is a fibre supplement, not a meal replacement. It runs roughly 30 calories per tablespoon, so if your dog's overweight, you need to subtract that from their regular kibble portion to avoid weight gain. Crank up the pumpkin, pull back the kibble, keep the calories flat. Welcome to trick number 2. This is the single most overlooked inflammation control strategy in home anal gland care, and it has everything to do with the chemistry of the fluid inside the sacs. When anal gland fluid sits inside the sacs for too long, because of poor expression, it thickens, becomes pasty, and the tissue lining the sac wall becomes chronically irritated. Over time, that chronic low-grade inflammation changes the consistency of the fluid itself, making it even harder to express, creating a vicious cycle of impaction. We can break this cycle from the inside out by changing the fatty acid composition of your dog's diet. Most commercial dog foods are very heavy in omega-6 fatty acids, which drive inflammation. What we need is to push the balance hard in the other direction, toward omega-3 fatty acids, specifically EPA and DHA from cold water fish. Clinical veterinary nutrition research has repeatedly shown that omega-3 supplementation significantly reduces systemic inflammatory markers in dogs, and yes, that includes the lining of the anal sacs. The cleanest, most bioavailable source is wild-caught cold-pressed salmon oil. You can find it in liquid pump bottles in the refrigerated section of any pet store. The dose is body weight based. A rule of thumb is roughly 1,000 milligrams of combined EPA and DHA per 10 pounds of body weight per day. Always read the back label for the specific EPA and DHA content, rather than just the total fish oil volume, because the active dose is what matters. Here is how to deploy it. Pump the salmon oil directly over their food once daily with their main meal. The healthy fats also improve coat shine within weeks, which is a nice visible bonus. Now please listen to this crucial safety warning before you start pouring. 2 things you must memorize. First, just like the turmeric we discussed in a previous class, high-dose omega-3 fish oil is a natural blood thinner. If your dog's taking any prescription anti-inflammatory or blood-thinning medication, or is scheduled for any surgery in the next 2 weeks, including a routine dental cleaning, you must clear the fish oil with your vet first. Second, fish oil goes rancid extremely fast once opened. Heat and light destroy the EPA and DHA. Always refrigerate the bottle after opening, write the open date on the cap in marker, and toss any bottle that is more than 3 months old. Rancid fish oil is toxic to the liver. Alright, here we are at trick number 3. This is a movement and body condition strategy, and it is the most powerful long-term architectural change you can make for your dog's anal gland health, because it addresses both the engine and the chassis. Let us start with the engine, which is daily physical motion. Walking your dog is not just for their heart and their brain. The mechanical act of walking triggers the gastrocolic reflex, a natural biological signal that pushes stool through the colon on a predictable schedule. Dogs that get limited activity tend to have sluggish gut motility, which means stools sit in the colon longer. Sitting there, they lose water, becoming harder, smaller, and less effective at squeezing the glands. A dog that walks briskly 2 to 3 times per day produces a more consistent, bulkier morning stool, which is consistently more effective at natural gland expression than the stool of a dog that lies on the couch all day. Now let us address the chassis, which is body weight. Extra body fat does more than just slow your dog down. It physically deposits around the pelvis and the perineal region, weakening the very muscles that help support natural anal sac function during defecation. The pelvic floor muscles act like a secondary squeezing mechanism. When they are weak from disuse and excess fat, they cannot assist the stool in emptying the sacs. The same body condition rib check we use for joint health applies here. Run your flat hands down your dog's sides. You should feel the ribs easily, like the backs of your knuckles without pressing. To deploy this step, commit to 2 structured leash walks per day, each at least 20 to 30 minutes, at a pace where your dog's moving continuously. Pair that with strict rib check weight management using the green bean kibble substitution trick I taught in a previous masterclass. Lean dogs walk better, press out better, and empty better. Now please listen to this final safety warning, and this one is the most important one of the entire class. These 3 natural home strategies are powerful tools for managing chronic, mild anal gland congestion in otherwise healthy dogs. They are not a substitute for veterinary emergency care. If your dog shows any of the following red flags, stop the home protocol and get to your vet immediately. Bright red blood or yellow-green pus draining from the area around the anus. A hot, swollen, painful lump on either side of the anus, which indicates a forming abscess that may need to be lanced and treated with antibiotics. A dog that is suddenly refusing to sit, is crying out when defecating, or running a fever. Any of these signs means the situation has moved beyond the home toolkit, and delay can lead to a ruptured abscess, which is a surgical emergency. Also, please never let a groomer, a friend, or a YouTube comment section teach you how to manually express your dog's anal glands by squeezing them externally. Done incorrectly, you can rupture the sac wall, introduce infection, and cause permanent nerve damage to the anal sphincter. Only a trained veterinary professional should perform a manual, external, or internal expression. Now, we have covered 3 genuinely life-changing home strategies that you can start tomorrow. But before we wrap up today's masterclass, I have a profound ethical responsibility to you as a medical professional, and I want to give you the honest scientific truth about chronic anal gland disease that many internet blogs will try to hide from you. If you read articles online, you will see people promising permanent, forever cures with one weird kitchen trick. As a veterinarian, I need to tell you the truth. Some dogs, particularly small breed dogs like Chihuahuas, toy poodles, basset hounds, and cocker spaniels, are anatomically predisposed to chronically narrow anal sac ducts that simply will not empty fully, no matter what you put in their food bowl. For those dogs, occasional manual expression by your vet is a medical necessity, not a failure of your home care. Joint disease has permanent structural changes, and so does chronic anal sac disease. We can dramatically reduce the frequency of the problem, but we cannot rewrite your dog's anatomy. And this brings me to a vital medical warning. If your veterinarian has diagnosed your dog with a true anal sac infection, abscess, or chronic impaction that requires prescription intervention such as anti-inflammatory medication, medicated flushing of the sacs, or surgical removal of the glands in severe refractory cases, please do not ever abandon those treatments in favour of only pumpkin and salmon oil. Doing so can allow a quiet infection to escalate into a full, body-wide sepsis risk. The goal of our natural home strategies is to beautifully supplement your dog's medical care, not replace it. By using these 3 steps alongside proper veterinary guidance, you are working in perfect harmony with your dog's biology. You are engineering the stool with pumpkin fibre, so the natural squeeze happens at every bathroom walk. You are calming the chronic inflammation with wild-caught omega-3 fish oil. You are strengthening the pelvic engine with daily brisk walks and lean body condition. By doing these things, you are dramatically reducing scooting, supplementing your dog's veterinary care, and giving them back their dignity, and giving your carpet back its dignity too. The fact that you sat here today to deeply study canine anal gland biomechanics and inflammatory nutrition proves what an extraordinary, deeply loving pet parent you are. Start small. Pick just one trick to try tomorrow morning. Your dog will not understand the science, but they will absolutely feel the relief. How old is your dog, and have they ever had a vet express their glands? Let me know in the comments below. I read every single story, and I want to support your journey. So, if this masterclass gave you some practical, safe, and honest tools to help your dog stop scooting today, please hit that like button and subscribe to the channel. Your support helps me keep sharing these free veterinary secrets with pet parents all over the world. I am Dr. Logan Wells. Give your beautiful pup an extra belly rub for me tonight. Sleep well, and I will see you all in the very next.